Hello, this is Dr. Girija Wagh from Pune, gynecologist and fertility specialist dealing with high-risk pregnancy for the past 29 years. In today's episode, we are going to talk about artificial reproductive technology. It used to be called in the past, and currently we call it as assisted reproductive technology, or what people very easily understand as test tube babies, or what is also called as scientifically in vitro fertilization. So let's first understand what is this IVF pregnancy. IVF is a mnemonic for in vitro fertilization. What does this mean? That the fertilization of the egg and the sperm occurs outside the woman's body. And this is done in an assisted fashion to be able to ensure a successful pregnancy. Now, ART is assisted reproductive technology, which encompasses a lot of things. Like it can also involve ovulation induction, it can involve intrauterine insemination. And these techniques we are going to discuss in our other videos. In this particular video, I'm going to take you through the step-by-step towards ART IVF pregnancy, that is assisted reproductive technology in vitro fertilization. Now, as we know, to make babies we require two important things: gametes from the man and also from the woman. So eggs from the woman and sperms from the man. And this is usually done for reasons where it is found that fertilization is not going to be possible in the natural way. So it can be that the woman's biological clock is ticking faster, or that her tubes are blocked, or the man's sperms have some issues or certain challenges which require assistance. So first and foremost, the first step is pre-pregnancy optimization of the woman's health, because finally the baby is going to be implanted in her womb and the woman has to be healthy. And this pre-pregnancy optimization can take anything between 3 to 6 months depending on what is your condition. And this will also be explained in one of our other episodes. So how do you retrieve eggs from a woman? In vitro fertilization, a condition or a process of controlled ovarian hyperstimulation is undertaken. So how is this done? We give you a series of injections on a daily basis, usually starting from the 7th day of your cycle, or sometimes from the first day of your menstrual cycle itself. And these series of injections are given with the purpose of stimulating your ovary to make more and more eggs. This is eventually and regularly monitored by doing sonography or certain hormonal blood tests. And then, depending on all these things, we decide whether your eggs have reached a particular maturity level. Now, therefore, the first step is stimulating your ovary by these medicines. And these medicines are given in different protocols. So, depending on what is your background condition, on your age, what is your biological clock, and what has been your past sort of an experience with similar kind of medications, the doctor decides what protocol is going to work for you. And once those eggs reach that particular retrievable stage, the doctor gives you an appointment for what is called as OPU, that is ovum pickup. Now this ovum pickup is done under anesthesia. So you have to come prepared, all the instructions are given to you, you have to have a day's hospitalization, you are taken in the operation theatre, given anesthesia, and by sonography guidance through the vagina, with a special kind of a retriever, the doctor takes your eggs and aspirates it. These eggs are collected in a special medium. So the second step is OPU. Now these eggs are studied under the microscope by the embryologist for their capacity of getting fertilized, for their quality, whether they are healthy eggs or not, and whether there are eggs or not, because they are seen only by a microscope. Parallelly, at that time, the husband is asked to give his sperms. So the semen sample is collected maybe the same day Or sometimes in some men, we also advise to have pooled semen sample, which can be collected priori, so that there is no issue of the semen not being available on that particular day. Then this semen is processed, that is number 4, where the semen is processed. And these sperms are kept alongside the retrieved eggs in a peculiar medium in the lab so that they are able to fertilize voluntarily. If that seems to be unlikely, then the 5th possibility which is undertaken is ICSI, that is intracytoplasmic sperm injection. So the sperms are actually injected in the egg and then they are kept in the incubator, and in the incubator over a period of next 24 to 72 hours they are constantly examined to see if there is fertilization. Now how do you identify fertilization? You can see that these cells multiply. All these pictures, labels that they are your eggs are kept properly into the laboratory, and every day the embryologist keeps on keeping a tab on that and informs the doctor that yes, the eggs have reached certain cell level. So usually these cells are counted, and then we decide whether it is a cycle day 3 or a cycle day 5 embryo. And then depending on their quality and the rate of multiplication, the doctors decide whether these eggs are going to be, now fertilized eggs are going to be frozen or not. So what we normally do in the current practice is we freeze these eggs either on the 3rd day or the 5th day, because it has been found through research that frozen embryo transfers are associated with better outcomes. Because even in the same cycle, when you've been stimulated with so many medicines, if we try to put a fresh embryo transfer, there is a likelihood of a complication which is called as ovarian hyperstimulation. Because of so many injections being given to you, the ovary may increase in an abnormal size, giving rise to certain challenges in your health. And this is called as ovarian hyperstimulation syndrome, or OHSS. Of course, in the today's era, with better protocols, wonderful medicines that are available, there is very, very rare occurrence of such a disease. But we require to monitor this. And the last step after this is the embryo transfer. So these embryos, which are either frozen or fresh, on a particular day, we look at the lining of the uterus, try to look it on the sonography or by doing some tests, find out whether it is now pliable for the egg to get implanted, for the fertilized egg to get implanted. And that is the time when we decide to do this embryo transfer. So embryo transfer is, you are again given an appointment, you're called in the laboratory, and we just place fertilized egg inside the endometrium under the sonographic monitoring. And then that pellet is released into your body, and then we wait for the fertilized egg now to get stuck to the lining of your uterus, and this condition is called as implantation. So usually after the transfer of the embryo inside, the doctor tells you to do your blood test at around 14th to 15th day to find out whether you are conceived or not. And later on a peculiar level of those hormones or on a particular day, you're advised to come for a sonography to confirm your pregnancy. A clinically confirmed pregnancy is the one where you can see the fetal cardiac activity and the heart beating. So these are step to step about IVF pregnancy. Many times I find patients are extremely impatient, and sometimes even their families, as to when is this going to happen. Now just imagine your body naturally takes care of all these processes. But these have to be evaluated through assisted reproductive technology. And these are the steps that you have to undergo. It's always better to have a positive attitude. Trust your doctor, trust yourself, and wish you all the best in case you are concerning or considering this kind of assisted reproductive technology. Things should fall in place. Bye-bye. This is Dr. Girija Wagh, gynecologist and fertility specialist, Pune, Maharashtra.